The survey has found Australians have an increased appreciation for how their healthcare system dealt with the pandemic, but there's plenty of blame to be shared around for the vaccine rollout. To take us through the findings of this True North survey, joining me live is Nick Cater, Executive Director of the Menzies Research Centre. Nick, thanks for your time. Easy to forget that the big issue at the start of this crisis was, would our hospitals get overwhelmed? They didn't, and a lot of faith in our healthcare system now.
There is, and we've been focused a lot, of course, on the vaccine rollout, and properly so. But when we ask people overall, or when True North asked people overall how their perception of the health service had increased or not, 71% said they thought it was a better health service than they thought this time last year. And interestingly, 75% of Labor voters said that, and 83% of Nationals. So people are saying, well, look, it has worked pretty well. And those figures are also reflected in their appreciation of the performances of both state and federal governments.
Yeah, so let's look at that. First of all, the federal government. This is quite interesting. We'll break this down by how each state thinks of the federal government's response. As you can see here, it's pretty uniform, bar the Northern Territory, which is very low. Look, the lack of seats in the federal election will mean I don't think that will worry the federal government too much. What's interesting is Victoria is actually the lowest, and maybe a bit of the state-federal war going on there affected that. But places such as WA and Queensland, who have been teeing off the federal government, are as high as anywhere else.
Yeah, this is a very interesting measure. So you ask people, well, how do you rate the government's performance out of 5, and you get to this average figure. And as you say, it's doing pretty well there, around 3.5% or a little bit under in some states. Interesting, as you point out, or that they've done badly or relatively.
Out of 5, I should clarify, by the way, Nick,
well
just these marks in case people think they're very low. I should have clarified that.
Yeah, that's right. Well, you've got in Victoria, federal government's a bit less appreciated, but so's the state government. When you go into those figures, you'll see that the federal government's actually doing better in people's minds in Victoria.
Well, let's bring that up. Let's bring up the states. I think this is interesting as well. So this is what each group of state voters think about their own state's performance. Again, Victoria's the lowest, and this is where you see a bit more disparity. WA, well, 4.3 out of 5. I'm surprised it's not 6, given what you hear out of those voters. But Queensland, not all that high. So it's a bit more of a mixed message if we look at this response.
Yeah, it is. I mean, very clear sort of thumbs down, if you like, or relative thumbs down at least for Dan Andrews in Victoria, and that's lower than they give the federal government there. Amazing that figure in WA, isn't it? 4.3 out of 5. They love McGowan and the way he's handled this, and that was reflected, of course, in the election. Interesting, the other place where state or territory governments perform badly there is the ACT, and I'm not quite sure where that is, but maybe it's because there are more people working in the federal government there and they appreciate the federal government's efforts better. But look, I mean, amongst the details, Tom, I think it's important to say that most people think that both state and federal governments are doing pretty well on this. And certainly if you were to compare this with international data, which we haven't done, you'd find people think our health service is standing up pretty well.
That's certainly true. Now, you've also pulled out the one issue that isn't going to have a lot of praise sung about it, the vaccine rollout so far. Now, this is quite interesting, I think. So let's pull up the reason why people believe there's an issue with the vaccine right now, the rollout. So what do you think's most responsible for this? A couple of things I'd like to point out here. First of all, that people are buying into the federal government saying it's a supply issue. So suppliers, you can see the red 23%, but also other countries, and that's around whether or not other countries are blocking supply. So all up, quite a few people think it's out of our hands, but the highest individual response is still federal government. And if you add in 17%, that's infighting between the federal and state governments. That'd have to be a bit of a concern, Nick.
I would imagine, well, up to a point, Tom. I mean, I think the thing is, if you listen to some of the commentary, you'd think everybody was just blaming the federal government for everything here. Now, people don't. They're smarter than that, right? They can see what the federal government can control and what it can't. So I think the fact that more people blame those factors outside our control, like the international supply and what other countries are doing in terms of withholding supplies, shows how smart people are. They're not flim-flammed by the commentary. They can see what's going on, and that there's a mixture of state and federal government responsibility. But going back to those earlier poll results on the overall performance, I think what it shows is, well, it's obviously people are concerned about the vaccine. They want to get it as quickly as they can, as safely as they can. It's not really affecting their overall appreciation of how well governments have done on this crisis right the way through. So I think if there's encouraging news for the federal government and indeed the state government, it's that. I think they need to steady the ship and just keep doing what they're doing, because people understand that this is a very difficult situation, and you know, not everything's going to go perfectly.
Some interesting results. We might keep tracking, in particular that vaccine one. Nick Cater, thanks for your time today.
Thank you.